What is novel coronavirus? The 2019 novel coronavirus, provisionally named 2019 ncov, informally known as the Wuhan coronavirus, is a contagious virus that causes acute respiratory illness, a respiratory infection which causes the ongoing 2019-20 Wuhan coronavirus outbreak. Genomic sequencing has shown that it is a positive sense, single-stranded RNA coronavirus. Many early cases were linked to a large seafood and animal market, and the virus is thought to have a zoonotic origin. Comparisons of the genetic sequences of this virus and other virus samples have shown similarities of 79.5% to SARS-CoV and 96% to bat coronaviruses. This makes an ultimate origin in bats likely, although an intermediate host cannot be ruled out. Symptoms. For confirmed 2019 ncov infections, reported illnesses have ranged from people with little to no symptoms to people being severely ill and dying. Symptoms can include fever, cough and shortness of breath. CDC believes at this time that symptoms of 2019 ncov may appear in as few as 2 days or as long as 14 after exposure. This is based on what has been seen previously as the incubation period of MERS viruses. Tips and advice. 1. Wash your hands frequently. Wash your hands frequently with soap and water or use an alcohol-based hand rub if your hands are not visibly dirty. Washing your hands with soap and water or using alcohol-based hand rub eliminates the virus if it is on your hands. 2. Practice respiratory hygiene. When coughing and sneezing, cover mouth and nose with flexed elbow or tissue, discard tissue immediately into a closed bin and clean your hands with alcohol-based hand rub or soap and water. Covering your mouth and nose when coughing and sneezing prevent the spread of germs and viruses. If you sneeze or cough into your hands, you may contaminate objects or people that you touch. 3. Maintain social distancing. Maintain at least 1 meter (3 feet) distance between yourself and other people, particularly those who are coughing, sneezing and have a fever. When someone who is infected with a respiratory disease, like 2019 ncov, coughs or sneezes, they project small droplets containing the virus. If you are too close, you can breathe in the virus. 4. Avoid touching eyes, nose and mouth. Hands touch many surfaces which can be contaminated with the virus. If you touch your eyes, nose or mouth with your contaminated hands, you can transfer the virus from the surface to yourself. If you have fever, cough and difficulty breathing, seek medical care early. Tell your health care provider if you have traveled in an area in China where 2019 ncov has been reported, or if you have been in close contact with someone who has traveled from China and has respiratory symptoms. Whenever you have fever, cough and difficulty breathing, it's important to seek medical attention promptly, as this may be due to a respiratory infection or other serious condition. Respiratory symptoms with fever can have a range of causes, and depending on your personal travel history and circumstances, 2019 ncov could be one of them. If you have mild respiratory symptoms and no travel history to or within China, carefully practice basic respiratory and hand hygiene and stay home until you are recovered, if possible. As a general precaution, practice general hygiene measures when visiting live animal markets, wet markets or animal product markets. Ensure regular hand washing with soap and potable water after touching animals and animal products. Avoid touching eyes, nose or mouth with hands, and avoid contact with sick animals or spoiled animal products. Strictly avoid any contact with other animals in the market, such as stray cats and dogs, rodents, birds, bats. Avoid contact with potentially contaminated animal waste or fluids on the soil or structures of shops and market facilities. Avoid consumption of raw or undercooked animal products. Handle raw meat, milk or animal organs with care, to avoid cross-contamination with uncooked foods, as per good food safety practices. These are the tips on how we can avoid Wuhan 2019 novel coronavirus. If you have any suggestions or comments, please leave it down below. We are willing to find a solutions for your request. Thank you for watching. Please subscribe and hit the bell button for more updates. See you next time.